New question, the member from Newmarket, Aurora.
Thank you, Speaker. To the Minister of Health. Speaker, the Minister has been boasting about a new management team at Ornge since January of 2012. One would have expected that a competent and experienced management team would have at least ensured that the
Minister of the Environment come to order.
Federal safety regulations would be met by that organization. But we find this week that a Human Resources Canada report cited that Ornge failed to comply in 6 specific areas, including failing to adequately train pilots on the hazards associated with operating helicopters in Northern Ontario, especially when flying for nighttime emergencies. Speaker, this is under the current management team. I want to know from the Minister, how much more evidence does she need to conclude that Ornge does not have the core competency to manage an aviation business, and will she agree to transfer that to...
Thank you. Thank you. Minister of Health, Long-Term Care.
Speaker, interesting to hear the recommendation from the member opposite. No, we will not be transferring Ornge to a private sector operator, Speaker. The improvements at Ornge have been significant and tangible and real, and they have been working with HRSDC to ensure that they fully comply with the directions made by HRSDC, Speaker. They have already moved on a number of fronts. I will go over them again. Additional training for helicopter pilots, including controlled flight into terrain. The revised operating procedures for night operations, including operations into black hole sites.
Answer.
They're installing solar lighting pads at 91 helipads, including in the north, to assist pilots landing at night. Speaker, they're auditing all training records.
Thank you. Parliamentary.
Speaker, how much longer will this minister put pilots and paramedics and patients at risk? It is very clear, not only the HRDC report, but there were 2 Transport Canada reports issued earlier this year that show non-compliance in a number of areas, specifically with regard to pilot training. Training pilots on simulators in a model that is different from the model they're being asked to fly. Not training pilots in terms of de-icing. Fundamental issues that any company with the experience and competency in aviation would know. It shouldn't take a report to point out the shortcomings of the management at Ornge. This minister, intent on keeping the MAZA scheme in place, continues to put pilots and paramedics and patients at risk. When will she agree to finally settle on making the important changes there rather than perpetuating a MAZA scheme? That's my question. Will she take the necessary leadership? Will she do that?
Be seated, please. Thank you. Minister of Health, Long-Term Care.
Speaker, if the member opposite actually would take off his ideological blinkers and look at what's actually happening, he would see that that change is well underway, Speaker. I'm going to continue with some of the changes that have been made since May 31st, Speaker. They're hiring flight operations quality assurance inspectors and a manager of flight training and standards. They're auditing all training records to identify and address any training needs for staff. They're ensuring that all helicopters have advanced avionics in their fleet, Speaker. These steps that are being taken will continue to improve the quality of care. But the people at Ornge are doing excellent work, Speaker. Just yesterday, they transferred 32 patients. 4 little children got to the health care they needed, thanks to the good work of the people at Ornge.
Thank you. New question.